this is a video that's basically going to be walking you through how the beginning interview should look. So we'll be going through the case history form, moving into your LORDFICARHO to try to narrow down what their issue is. I'll let you know when the objective testings would be inserted into the whole sequence, and then moving into the informed consent. Okay, here we go. Hi John, how are you doing?
Good.
Good. So what I'd like to do with you today is just go over your health history form and just ask a few further questions, if that's all right?
Sure.
Great. All right, so I see here that you work for the city?
Yes, I do.
Okay, and is it a laborist position?
Yeah, it's fairly intense.
Okay. And I see that your sleeping patterns are quite good. No medications. Do you take any vitamins or anything?
None.
None? Okay. All right, and I see that you see a chiropractor. How often do you see them?
Every couple months, just for some maintenance.
Okay, good. Sounds good. Okay, and then just looking through conditions and histories of conditions, that you have a little bit of history of low back pain, and it's mostly into your shoulder and neck, is that correct?
Yeah.
Okay, and is it both sides or just one side?
Mainly on my left side.
And then your left, okay. Okay, that's pretty much all the questions I wanted to ask through there. So you said the majority of the pain is on your left side into your shoulders?
Shoulder and then down to my elbow.
Okay. When did this start?
A couple months ago.
A few months ago? Okay. And you said that the pain goes down into your elbow. Does it move anywhere else?
No.
No? Okay. And when you have the pain, how long does it last?
A couple hours.
Okay, that's not too bad. Does this happen often though? Like how frequent?
Every so many days.
Okay. And on a pain scale of 1 to 10, 1 being virtually no pain and 10 being the worst pain imaginable, where are you sitting today?
Between a 5 to a 6.
5 to a 6, okay. And what kind of pain is it? Is it stabbing, throbbing, burning, shooting?
Just throbbing, shooting.
Okay, and that's the shooting is when it goes down to the elbow?
Yeah.
Okay. And what things do you find make it worse?
Just when I'm at work digging, jackhammering.
Okay. Anything that you found makes it feel better?
Massage, chiropractor, hot shower.
Okay, good. Now, do you have a history of this type of pain?
Not really, it just started happening this last, 3 weeks.
Okay. And anything else that you think that I should know about?
No.
No? Okay. All right. Okay, so at this point is where you would start to look for any of your objective information. So you could move into any sort of palpation testing. You would be moving into your range of motion for sure. I recommend you do range of motion with every client that has a specific issue. So at this point I would be doing range of motion through his cervical spine and through his shoulder. Now you'll get into the more specifics of what types of range of motion once we move into that unit. Also, when you move into your second quarter, you'll be learning some more specific orthopedic testings, and this is where at that point you would be doing those testings as well if indicated. These are all basically things you need to look at as little puzzle pieces to try to figure out the root cause of the problem so you can develop a beneficial treatment plan with a client, okay? Okay, so it looks like today we'll be going ahead and you want me to focus into the left shoulder?
Left shoulder, low back. Maybe a little bit of full body.
Sure, we can definitely do a full body as well. So working into your shoulder and full body, what's this going to do is it's going to increase your circulation, so it promotes tissue health. We're going to decrease pain, and it should help with some relaxation as well. So what we're going to do is I'm going to start you face down on the table. Okay. So there's 2 pillows on the table. So the top pillow is going to go through your abdominal area, okay? And the bottom pillow goes just below your knees, so it kind of fills in your shins, so it's a little bit more comfortable for you. So lay on the bottom sheet and cover yourself up with the top sheet.
Okay.
I'll ask that you undress down to lower underwear is preferred, but whatever level of comfort is good for you, it's fine. I can work around as well. If you do undress down to lower underwear, it's just a little bit more beneficial for me because I can access all of the muscle groups and where they attach okay? Now, you're going to be professionally draped at all times. The only time that you're going to be uncovered or a body part is going to be uncovered is if I'm actually physically working on that body part at that moment. Otherwise, you will be professionally draped and covered, secured, okay? Now, you could get some kickback pain from the treatment. Literally, it just kind of makes you feel tender and a little kind of congested through the muscles, and that's completely normal. But what I'm going to do at the end of the treatment is I'm going to give you some home care that's going to help reduce the eventuality of this actually happening. Okay. If at any time during the treatment you are uncomfortable with any of the techniques that I'm doing, please let me know and I can change my techniques. Or if you want to stop the treatment, you do have the right to stop the treatment at any time. So just let me know and we can go ahead and discontinue the treatment from there. Okay. Do you have any questions for me at this point?
No.
Okay. Do I have your consent to proceed with the treatment?
Yes.
Great. All right. So that is your case history and the investigative LORDFICARHO, and then you would move into your informed consent. At that point, you would direct them to go on the table as you leave the room to wash up.